What is going on, guys? Welcome to another episode of the Masculine Health Solutions podcast, where I am joined by Dr. Paul Gittens, who is going to give us the lowdown on sperm health, a little bit about fertility and infertility, which is one of the things that a lot of guys have reached out to me and asked me, or just looking for that second opinion. But I'm not an expert on these things, but Dr. Paul Gittens actually is. So, first and foremost, Dr. Gittens, how are you, man?
CJ, it is great to see you again. I think we spoke it's probably been about 6 months or so. I'm so happy to see where your podcast is going, and I always wish you the best. You're already fantastic, but you're gonna reach all the goals that you put in front of yourself.
Hey, man, I appreciate that. And honestly, one of the biggest goals that I got right now is just kind of getting men's health at the forefront, because I feel like guys are kind of getting left behind. There's a lot of other resources for other people, but one of the things that I do want to see is more guys open up and talk about the subjects that we're talking about right now. And I mean, one of the biggest things that we are going to focus on today is infertility and what's causing that and what's at the root cause of it. So the first thing I kind of want to open up with is, what is male infertility?
Yeah, you're right. Even when you're saying that men are often forgotten, you're absolutely right. For a number of things, but especially when it comes to fertility. A lot of the emphasis for fertility is directed towards the female partner, right? And not enough is dedicated to the male. Because when you look at the data and you say, all right, who contributes to what when it comes to fertility issues in a couple, when it comes to a couple, it's about, in general, I mean, it does sway a little bit towards the female side, but you would say it's about 45-55 or so, right? So, so male infertility is extremely important. And the definition of fertility has changed throughout the years, but in general, it's a couple that's been trying to conceive for about a year and they're having some difficulty in doing that, right? And when we say trying to conceive, we're saying that a couple that are trying timed intercourse, right? So we know that there's only a few days in the month that a woman can become pregnant, right? And so, usually what we recommend is even if you're using like an ovulation kit or something like that, but you want to have intercourse at least every other day around the time of ovulation, and that's about 14 or 15 days after her period, right? And that's kind of timed intercourse. We want to do every other day. And then when couples have difficulty after about a year, then we start saying, all right, this is possibly a possible fertility issue. It could be male, it could be female, right? But both of the partners need some kind of workup. And when you look at, there's some data in terms of like the length of time it takes for, someone to get pregnant. So we say in 1 month, about 25% of couples that are trying will have a pregnancy, right? In about 3 months, there's going to be about 50%. In 6 months, 65%. 12 months, about 80% of couples should get pregnant, especially if they're doing timed intercourse. 24 months, about 90%. So, when you look at infertility in a couple, it's about 10 to 15% of couples will have fertility issues because they're not going to get pregnant in that time, right? So you're going to have you have an infertile couple. And then I think, my recommendation is for both the male and the female to get worked up. And as a male reproductive physician, as a urologist and sexual medicine specialist, you want to start with a semen analysis. Is really simple, right? A semen analysis tells you a lot, right? If the semen analysis comes back and the male has several million sperm, and there's cutoffs. Obviously, we look at a number of different parameters when we're looking at sperm. We look at the count. We could look at motility, which is if the sperm are moving. We look at the progression, so how well they're moving, right? And then we also look at morphology. Morphology is something that tells us about the shape. And we look at the head, we look at the neck, we look at the tail, make sure they have one tail instead of two tails. And then we're able to kind of see exactly, what's going on with that couple. And obviously on the female end, I don't do female fertility, but on the woman's end, she's gonna undergo blood work, and we could talk about the workup as we get through this. But she'll go undergo a workup with blood, and she'll do some ultrasounds and other things, which you should be able to identify which one of the couples has some kind of fertility issue.
It's super interesting because I mean, the one thing I never thought about there, where you mentioned like, because I always just thought sperm motility was like the ability for the sperm to basically like swim to the egg, right? But now that you're mentioning like mutations and stuff, what are some of the strangest mutations you've seen when it comes to sperm?
So I mean, when it comes to sperm, when you're looking at morphology, you can have, and I wouldn't say it's a mutation. I would just say it's a variant of normal, right? And so
Sure.
there's some sperm that have larger heads than others, right? There's some sperm that have larger necks, right? Because you want to think of a sperm as kind of like a tadpole sort of thing, right? And then some of the sperm have, one tail, two tails, a half of a tail, short tails. You know, not every sperm looks the same, right? But in general, at least 4 to 6% of your sperm should be morphologically normal, and that's what we're looking for. And on that semen analysis test, it'll tell us the morphology, which kind of indicates how the sperm look and the percentage of normal.
Interesting. Yeah, because I'm guessing if you do see like a commonality of a ton of abnormal looking sperm, I'm pretty sure that's like a red flag for something's off as well, right? Because
Well, yeah, exactly. So if your morphology levels are low, so a low percentage of morphology, which are normal, so but we say it's a low morphology, then you're right.
okay.
Then there's something going on with that person. Um, it could be, I mean, and we can get into like all the different types of reasons why guys have fertility issues. So as a provider, I want to make sure I look into all those different causes of fertility issues and see if we can help them.
Yeah, so my question is, as you're talking about this, is like, what are some of the contributing factors to that? Because I know that
Yeah.
before we kind of started discussing this, I keep hearing different things. I'm like, okay, what's a myth? What's true? It's kind of like you always hear, like, don't put your laptop on top of your balls because it's gonna microwave your sperm. All kinds of different things. But what are some of the things that you can say there's concrete evidence to indicate that this is altering the sperm morphology?
Well, or the sperm concentration, right? So the
Yeah.
concentration is the number of sperm, or the motility in terms of how they're moving,
Mhm.
or the number of sperm that are moving and the direction they're moving. So we take all these things in consideration when we're looking at and trying to identify why this person has fertility issues. And there's some big categories. So some big categories are hormonal causes, right? So some guys may have low T. So I think we might have spoke about testosterone a little bit
Yeah.
before. Um, that doesn't mean you should take testosterone. So I'm just going to pause here. We're going to go through everything. So I want you to tell everybody, all of your listeners, testosterone will cause male infertility. Okay, make
Interesting.
sure
Is that from
everybody knows that. It will
my
lower your
question?
sperm counts. Do not take testosterone if you're interested in having a child. Okay, what were
See,
you gonna?
that's yeah, no, I was gonna cut you off right there because I'm like immediately that I think of all the guys that are juicing, right? And
Yep.
I know some of them are able to get their wives pregnant or girlfriends pregnant, but are you saying from it's an excessive amount? Because what if a guy's doing TRT and it's kind of regulated? How does
So if
that
they're
kind of go
doing
both?
TRT, they have low sperm counts. Oftentimes, guys who if you want to say, are using anabolics,
Mhm.
the way they get their partners pregnant is oftentimes they go post cycle. So their post cycle therapy may be able to help
Oh,
that. So when they go on HCG and Clomid and some of these other things that we use as well. In general, though, even if your physician is the best physician in the world and he's managing your testosterone, your sperm counts are lower. I can't say they're
really?
always zero, but they're lower, much lower, probably to the point where you at least have subfertility, right? So,
Interesting.
that's probably the number one of the top 5 reasons why when guys come into my office and they're like, "Doc, I can't have a baby," and I look through their medications and there's a big testosterone cypionate or testosterone enanthate or one of the gels is on their medication list. I'm like, first thing we got to do is get you off this. I don't take people off of it directly. I just don't rip off the Band-Aid, because what happens is those guys will crash. So there's
Yeah.
ways to kind of lower their level of the synthetic testosterone and increase their endogenous or their testosterone they're making themselves, so they can kind of level off and they can feel okay, but then also be ready to have or start a family or continue their family.
That's super interesting
Yeah,
because
but yeah. Sorry, go ahead.
no, yeah, it's one of those things that we've always kind of a lot of people have always suspected, right? But the thing with like anabolics and bodybuilders, you don't really know 100%. It's not really studied. Plus, the case studies don't really exist for a bodybuilder that's juiced to the gills, and is what it's really
Yeah,
doing to his body.
but it's definitely it's scientifically proven that if you are on testosterone, what happens is also the guys that are on, if you talk to them, their testicles get a lot smaller, right? And
Yeah,
because of the fact that they're not making their own testosterone, but they're not making any sperm, right? So
interesting.
but I mean, and most of the bodybuilders, they know that they're mostly infertile. I can't say 100%. So if somebody says, "Listen, I'm on testosterone," Dr. Gittens says, I can't get you pregnant. You don't come after me." But in general, right, I would say probably like 95% of the guys aren't going to be able to have a child. Um,
Interesting.
so that's the first thing. So hormones. So we talked about too much testosterone, but if your testosterone's too low too, you can have a problem with fertility. I would say that a number of the guys that come in with fertility already have a lower testosterone level. But there's other
Nice.
hormones that you can have excess thyroid, some issues with growth hormone. You can have a lot of other hormonal abnormalities, too much prolactin, a lot of other things that hormonally can cause you to have some fertility issues. So it's not just testosterone. So we have to look at the whole combination of all the hormones that we have in our system. Another thing are physical causes. So there's things that we're born with. There's things that happen during development that can cause some issues. Some guys are born without something called a vas deferens, which is what we cut during a
Okay.
vasectomy, right? Some guys,
Yeah.
they have some clogging in the tubes of this area called the epididymis, which is this, it's like a sac-like gland on the back of the testicle, right? So you can have some issues with that. You can have something called a varicocele. So a varicocele is like varicose veins in the legs, but they're in your
Cool.
scrotum, and that can
Yeah.
cause some issues with heat, and that can cause some problems with sperm production, right? There's genetic causes, right? So things that were inherited or things that happen when in our development, that you can have a change in our genetic makeup, where you can have something like a deletion, which is like a deletion of a chromosome, or you can have an extra chromosome.
Oh,
There's a
what?
number of things genetically, or you could be missing the segment in your genetic DNA that actually makes sperm, right?
What?
It's called a Y microdeletion. So it's really some cool genetic things that can cause some issues with fertility. And then there's things out in the world. There's external factors, like there's medications that we talked to about one. Especially testosterone is one of the biggest ones that can cause some issue. There's toxins, right? There's and we call them gonadotoxins. They could be pesticides. There could be chemotherapy is another big one, right? Radiation can also cause some issues with fertility.
Mhm.
Um, and then there's a category of like the unknown, right? Why does this person, like everything else seems to be okay, but this person still has some fertility issues? And I think that's why we need more research. Some of that is probably genetic, that we just haven't figured it out yet.
Yeah.
But there's probably other things in our environment or that are, that we come across of some sort that we just don't have a good understanding of, that can also cause some fertility issues.
Super interesting. And the other thing that I was thinking about as you were talking about that is, I'm big. I've gone down the rabbit hole when it comes to the chemicals in our food and microplastics and obesogens and stuff. But would you say that obesity itself is a contributing factor to low, like, sperm
It
counts
is,
and,
yeah.
fertility
You're
issues?
you're you're on it. You've been reading the latest research actually on
Try to keep up, man.
yeah, and obesity, and it could be for a number of reasons. In some of our obese patients, their hormones are a little bit abnormal, and their testosterone might be lower. Um, there could be some issues with you're right, in terms of intake of what they're eating or drinking, but also kind of a heat effect as well, because don't forget their testicles are kind of in an area where it might be somewhat compromised because of the adipose of that
Yeah.
person. Um, they may make more, they have more inflammation. A lot of obese patients will have more inflammation in their system, which can also lead to some fertility issues. But it is documented that men that are more obese may have may be more likely to have fertility issues. It's not 100% correlation though, obviously, right? We have
Yeah.
larger patients that can father a child with no problem, but not all.
Yeah, I mean, the way I kind of see it, the older I get, I just realize how the body's a global thing, right? If you do one thing, it's going to affect other things. And that's kind of where people come and ask me about, like, hey, how do I improve my dick health? I'm like, well, maybe you should start off by losing about 200 pounds, you know, if
Yeah,
somebody's way up there and stuff, right? Because it's a combination of different things I find, anyways. And I think that, we can't really deny the fact that if you're pre-diabetic, maybe you should handle that before worrying about other things, other bodily functions, which I know
no,
it's all kind of
of
ties
course.
in.
But you got to understand, it's not so. It's when it comes to our health and like obesity and diabetes, and obviously we have to take ownership of it. But
Hmm.
sometimes it's not so easy for everyone, right? Sometimes, like, you may, when you get frustrated, right, you may go work out, right? Or you may,
Yeah.
where other people may get frustrated, they may eat a little bit more, and we know that in genetics, like, we know that there's genetic markers of obesity, right? So,
Hmm.
um, I think it's really talking to that person, and because it's easy to say, like, go lose weight, right? But we have to try
Check.
to figure out what's their triggers and how do we get them to lose weight so we can be on the same page as them and we can kind of work through this together. And even with
Yeah.
diabetes, it's tough. Diabetes, especially like when you get it, when you have diabetes when you're younger, it's something that you have to work on every single day, right? It has to be
Yeah.
in every part of your life. I mean, we take advantage, like, we can go out for dinner and, we want to have like desserts and we want to do all these other things and treat ourselves, right? But, for us, our body um, we'll be able to metabolize those things properly and, our insulin levels are the way they should be. And so it doesn't affect us. But for other people, they have like, you know, they want to take a cheat day and it could be devastating for them. So we
Yeah.
think we just got to figure out what makes someone tick and really try to help them the best we can. But I think waving that carrot in front of their face and saying, "Hey, listen, your penis is going to get better." Like, like, if you're going to wave a carrot at a guy
Yeah.
and you say, "Listen, your penis is going to get better if you do this." Like, I'm on board. Like, you tell
Yeah.
me what I have to do, and I'm going to do it. And I think a lot of guys feel that way. So it's really finding something that's really important to them. If it's their penis, if it's their kids, if it's whatever, and saying, "Hey,
Hmm.
listen, like this, you're living an unhealthy lifestyle, and it's going to affect whatever you feel is most important. So we got to get you out of it, and we'll help
A
you,
hundred
we'll walk you
percent.
through it, So
Yeah. And to your point, it is one of those things where I forgot who I was talking to was telling me the same thing, that it's until the guys have ED that they start to actually look into, like, okay, what's going on with me? And it's like, oh, I got to
yeah,
change up my diet. I got to do this. I got to bring down blood sugar. And all of a sudden, a lot of guys will actually look to improve themselves in ways that they could have before, but it's like, okay, now if shit just got real, it's
yeah,
like,
no, when it gets real, well, when you're in the bedroom and things don't happen the way you think they should, it's a wake up call, and sometimes you need a wake up call. There's guys that are proactive like yourself. You're going to get out there because you know what can happen. And you listen to all these
yeah,
guys and all these guys text you and everything and they respond to your podcast and you're like, man, I don't want to be like that. So I'm going to do this. Right. But for some people, they just need a wake up call. And if it's their ED, and we know, as you know, ED is it tells us what's going on with the rest of our body. So, I'm glad that they're doing it at some point, and,
yeah,
it's better to do it now than not to do it at all, and so
a
I'm
hundred
on board
percent.
with that,
Yeah, no, and I think it's one of those things that sometimes a lot of people wait until it gets worse to make it better. But if we can be proactive, take one step ahead, you'll always be in a better spot for the future. But my next question now is, we talked a lot about the negative kind of things and the negative things that we do to kind of impact sperm health, but I kind of want to get to the positive things, or things that we can do kind of on the proactive side to ensure that we can kind of have, the best, strongest sperm that we can have. Like, what would be the first thing that you would recommend anybody do to improve their sperm health?
Well, I would say, as we spoke a little bit about, so no testosterone. All right.
That's a
That's
big one,
number
eh?
one. That's a big one for me because it's happening
Jeez.
all the time. All right. So as you mentioned, like in what we talked about before, and what we always kind of go back to is really trying to be as healthy as you can be, right?
Mhm.
And so we want to make sure we're exercising, we're eating the right foods, we're staying away from those plasticizers, and I, I don't, I try not to drink out of like all those, the plastic bottles and all
Classic.
these other
Yeah.
things. These are things that could be cumulative where it can affect fertility.
Yeah.
Um, so those are major things. Is just trying to stay as healthy as you can. There are some things that are unavoidable, like genetics, right?
Yeah.
And we can't do anything about genetics. We can. There are some um, techniques that we can use for guys that have genetic abnormalities. So, for instance, like there's a syndrome called Klinefelter syndrome. Is when men have an extra X chromosome, and these guys, it's very common. It's fairly common, I should say. And most of these men, their sperm counts are either very low or they're almost zero when they do, or zero when they do a semen analysis, right?
Interesting.
And so for those patients, so what I would do is we'd possibly place them on hormones depending on what their labs values showed. But sometimes we have to actually do a surgery where I actually open up the testicles, called a microscopic testicular
Ooh.
dissection, and we actually have to go through. So when you open up the testicle, um, it's something they're these little they kind of look like little kind of worms, sort of, but in a weird way. But they're in the testicle. They're called the seminiferous tubules, right?
Okay,
And that's
yeah.
where the sperm are maturing, right? That's where our stem cells are, and that's where the sperm are maturing, and they eventually make it out, and they get to the vas deferens, and then they make it to the prostate, and then you're ejaculated out. But so sometimes we have to actually go through the testicle. We do something called a microscopic testicular dissection, where I open up the whole testicle, and then I use a microscope to see which tubules will have sperm, and then I'll have to hand that off to the IVF team. Okay.
Mhm.
And then we'd have their partner. Their partner will have their egg retrieval. They'll place the sperm that we find during the case into the egg to make an embryo, and then they go through IVF, and then they'll go through, the transfer and everything, and then hopefully have a baby. Sometimes though, there's a person that's blocked, right, because of genetic abnormality. So sometimes there's a blockage. And in those situations, so it's like somebody that had a vasectomy, but that vasectomy was something that was caused by their genetics, or something that
Hmm.
happened in utero, right? In that situation, what we can do, that means they're obstructed. And when we go through this, there's kind of two directions you can go. Either you're not manufacturing sperm, or they're blocked, right? So there's either something that's wrong with the factory, or the assembly line is blocked. And that's kind of how we think about sperm. So if the assembly line is blocked, that means you have a blockage. It's called obstruction. And so sometimes we can actually go into the testicle just with a small little needle, and we can just take sperm out that way. And then we can give that to the IVF team. All right.
Oh,
So
wow.
there's a lot of different directions you can go for the treatment of male fertility.
That's I mean, you gotta know what you're doing to be in there. It's immediately my immediate thoughts like, "Oh god." I mean, if that goes wrong or whatever, but o obviously this is what you're trained to do. But, I mean, my biggest question is, like, when you do that surgery, and, like, if the guy only has 3 or 4 sperm and you guys catch it, like, how do you maximize the potential of it all working out in the end when the IVF team, I guess they take it and they kinda make it work and they work their magic? Like, how does that whole process kinda look like, you know? Because obviously you extract it and then do you have
Yeah.
to be there, like, ASAP, or how does that
Yeah.
go
So we
about?
usually do, usually, I mean, obviously it starts with the patient, and they'll come into the office, and we'll do hormonal testing. We'll do genetic testing. We do a physical exam. And then when the semen analysis comes back, because we've ordered a semen analysis, when it comes back and it shows no sperm, then we're going to have to look a little deeper, right?
Mhm.
And then at that point, we may say, because we look at some lab values and we may say, all right, you are obstructed, all right, because there's some telltale signs to find if they're obstructed, or you have a problem with manufacturing sperm. There's no sperm here,
Yeah.
but there's a problem with manufacturing it, right? And then from there, we usually connect their partner with an IVF, like one of our local IVF clinics in the area of Philadelphia or New York or what have you.
Mhm.
And then at that point, we would decide which procedure we're going to have. If it's going to be an aspiration or if it's going to be more of like a microscopic testicular dissection. And so I usually
Interesting.
do those procedures at the IVF center. So everybody's on board, everything's timed,
Okay.
everybody knows what the other person's doing, right? And so I usually start if it's the couple, I usually start with the male because we want to know if they have sperm.
Mhm.
Um, so we start with the male, and I'll decide what we're going to do at that point, if it's going to be just an aspiration or if we're going to do the biopsy, the microscopic testicular biopsy. And then if we get sperm, um, the 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 female partners usually comes right after us, and they'll do an egg extraction. They'll get the egg, we got the sperm at this point, and they put everything together at the same time. It's
That's
simplified, but yeah.
yeah, it's kinda like understanding the process of it because I imagine you're kinda racing against the clock too, right? It's like a fish
Yeah,
out of
the egg
water.
exactly. The eggs can only be out for so much time, and then the sperm can get. But there are couples where, say, somebody had a vasectomy, right? And the partners just, they're like, I want to do the egg extraction. I'm not really sure at what point. I just want you to get your sperm. So in those situations, we can actually extract the
Oh,
sperm and then freeze it. And you can freeze your sperm, and then when the partner's ready, then they can go through their process. They can thaw the sperm out, and they can put everything together after that.
interesting. My question now, because I mean, I got a vasectomy and I'm never been happier. I got 2 boys, I'm happy, I'm done.
Yeah.
But let's say if my wife was to change her mind, which I don't think she is, could you do that same surgery, like, let's say with one of my testicles where you go in there and would the sperm still be alive or are they just pretty much done
Yeah, they're
at that
still
point?
alive. They're moving in there. They're moving in there. So there's two options for you. For a guy that had a vasectomy, and we do both. So, I was trained in microsurgery, and so
Mhm.
we would do in reproductive microsurgery. So we would give you the option of doing a vasectomy reversal. Okay. So that
Okay.
means I would
Yeah.
go into the scrotum. I would find the two ends of your vasectomy. I would bring them together, right? Connect them with these small little sutures under the microscope. And then, a few weeks later, hopefully you guys will become pregnant, or at least maybe a month or so, maybe, I hope. Yeah. And then you can do that, or you can go through IVF, right? And
Yeah.
with IVF, we could do it timed, or we can do it, you can go before your partner. And
Mhm.
what I would do is I would start with a small little aspiration into, so taking a small little needle going into that epididymis, which is that gland-like structure we talked about, and
Yeah.
on the back of the testicle, or we can go directly into the testicle.
Interesting.
So,
So there's still options.
there's plenty. You can have a baby. You can get going. If she changes her mind, you have my cell. Just give me a call.
Yeah. Just hit
I'd
you
be
up, say, "Oh,
come
man.
on down here. Come on down.
Oh, give me an excuse to go to New York." I mean, I'm down. That'd be interesting, but
Right.
but I mean, it kinda goes to show, like, because I guess somebody could get the my question is too, when I think about that is that I've seen a lot of young kids be like, "I don't wanna have kids when I get older," and then I'm like, "Yo, you're 19, 20." And
Yeah.
obviously they get to 30, 35, and they start to change their minds, right? And where you're telling me that, hey, you can kind of keep the vasectomy, but still get pregnant by doing this. So there's still different ways around it.
You could, but you shouldn't. You should really think of, because nothing's 100%, right? And so I
Yeah.
always tell, because I do vasectomies all the time, and oftentimes I have a person that comes in and he said, like, listen, I've never wanted to have kids. I don't want to have kids. I want to have a vasectomy, right? And
Yeah.
I always tell them, like, hey, listen, you should think of this as being permanent, right? Even though I know in
Mm.
the back of my mind I can reverse it or they can go through IVF. But when you're going through a procedure, you should really think of it as just a permanent solution. And you shouldn't really think of it as something that's temporary, because everything's got risks, everything's got complications, right? even if they may be low for the vasectomy, there's still complications. There's chronic ball pain, which we call post-vasectomy pain syndrome, right? There's
Yeah.
a small percentage of guys that may get that after the vasectomy, right? Or there's bleeding and there's infection, right? So it's not something you want to go through if you don't have to. Um, but if for guys that have gone through it and they've changed their mind, or sadly, during this whole this drug epidemic that we've had, I've had a number of patients that have come in and their child had died, and they wanted to do a
Yeah.
vasectomy reversal or IVF because of that. So there's a number of
Oh,
reasons why guys come in for reversals of their vasectomies.
how high would you say the success rate is for a vasectomy reversal?
Yeah, so it depends on so when we look at the success rates, we always want to look at the number one thing that we look at is the number one factor is how long are they from their vasectomy, right? So a
Uh-huh.
guy that had a vasectomy last year is going to have a better success rate than a person that had a vasectomy like 20, 30 years ago. I mean, we've had success for guys 20, 30 years ago, but the
Oh,
success rates across the board are higher um, when there's a shorter period from the time they had their vasectomy.
that's interesting because I guess things have kind of just fused together. It's almost like not really the easiest way to go back after, it's better when the wound is
Yeah, I
fresh, I
mean,
guess.
that's one of the reasons. The other reason is remember you're always making sperm, right? And so
Yeah,
it's just a backup in pressure, and then those tubes in the epididymis, they kind of start to get blown out and they start to get scarred and everything. So that's why it's a little bit harder after so many years.
and, you know, the other thing that I was kind of thinking about as you had mentioned that and mentioned obstructions and stuff is there any way that you can cause an obstruction or from like physical damage? Somebody's playing sports and I've heard horror stories and stuff of, different ways that, I remember one time, oh man, this was brutal when it was high school basketball. And apparently somebody said like they went for a breakaway, guy came down, landed on the guy's left nut and his right nut exploded. And I
Good
don't know
luck.
how these
Oh, wow.
things kind of work.
Yeah,
It was
yeah.
a pressure buildup or something. I'm like, I don't know. I just remember hearing the horror story and the guy
Mhm.
yelling and with yells that I've never heard before come from a male.
Yeah, yeah. So
Right?
you
But
can't. So trauma can cause, especially you have to have trauma to both testicles for the most part, but trauma can
yeah,
cause some issues. Um, surgery. So if you have bilateral, so two-sided hernia repairs, especially with mesh, sometimes can cause some. It's called a desmoplastic reaction. It can cause some scarring in that area, and that scarring can include the vas deferens because your vas deferens is that tube that we cut for the vasectomy actually goes into your groin. And then it goes into your abdomen. It goes around your bladder to get to the prostate, right? So
mhm,
um, so a inguinal surgery can cause some issues, but it's got to be both sides, right? So it's got to be both sides. So yeah, so trauma infection can cause it. So guys that have had chlamydia, gonorrhea, if it's not treated, they can have some issues with fertility. Um,
interesting. I didn't know
so
that.
there are other mechanisms outside of either medications or genetic reasons for fertility, but those are just a few.
That's interesting because I figured trauma would kind of play into it. As far as obstructions kind of go, would you say that's something that's more genetic and tends to be something that's kind of like internal and just kind of works out that way? Or is there any other way that, obstructions can be caused? Like you mentioned some of the STIs and stuff that would cause that scarring and stuff, but is there anything else that you could possibly do? Like, let's say kidney stones or something, I don't know. It just kind of
Yeah,
plays
no,
into it.
kidney stones
That's more
wouldn't
the
do.
penis, but
Yeah, it wouldn't. But that you could do outside of trauma that can cause an obstruction. You can have a vasectomy, but
yeah.
um, there you go.
It's a
Yeah,
big
that's a
one.
wanted. That's a wanted
Yeah.
obstruction.
Yeah. Say, all
I
right,
welcome
well, I
that.
can't. Yeah.
That's right. Um, I can't think of many things outside of like trauma or things like that. Infection. There's some genetic abnormalities, just like so. There's something called cystic fibrosis. Some guys have
Oh,
just one gene instead of two. So you would know they had cystic fibrosis by looking at them. Where if you have two genes, you would know the person that had cystic fibrosis because they would have some of the symptoms of and the phenotype of it. But um, cystic fibrosis, one gene can cause some issues with obstruction that that person wouldn't know that they had. There's other abnormalities where people are born with like one kidney and they can have some issues with their an area outside the prostate, your seminal vesicles, or the vas deferens themselves. So there are some other genetic things or some things that can happen in utero that can also lead to either obstruction or just other forms of fertility.
Interesting. And the other thing that I was thinking, because we talked a lot about the hardware, right, which is normal, and that's something
Right.
I think that a lot of guys probably deal with more often than not. But it kind of makes me think about the software, like the mindset, like when it comes to depression, these other things that kind of play into it. Do you find that that negatively affects sperm motility, sperm production as well?
So there's no, I mean, so if you think about like stress or something and you look at like wars over time, like you would think that fertility rates were probably less during like World War I and World War II. And I think some
Yeah.
data has been is out there, and it kind of goes both ways. I mean, depending on the paper, you know. Um, in terms of like depression, does that directly cause fertility issues? Probably not, but it can
Mhm.
cause some issues with libido. It can cause some issues with arousal, it can cause some erectile dysfunction. So secondarily, yeah, it definitely can cause some fertility issues. If somebody doesn't want to have intercourse, then they're going to have fertility issues. Um,
Yeah.
so those are the things, some of the medications that we use, like some SSRIs can delay ejaculation. And so some guys, if they're on some of the SSRIs, some men don't ejaculate at all. So that ejaculatory dysfunction can cause you to have fertility issues as well.
That's interesting.
So that's kind of
And
that's like a indirect way of how depression can cause it.
interesting. It's kind of like a, I don't know, like a secondary way that it affects it. But hey, man, if it affects it negatively, that's not a good thing.
Yeah, not a good thing at all.
But my next question that I was kind of thinking, as you had mentioned, the medications that work against it, are there any medications or other things that you could take that would promote, healthy sperm and just overall, I guess, more volume as well? Because I do see those things, sold sometimes like ejaculoid, double up your load, and I'm just like, does that
Let me
even
tell
work?
you, if I could increase volume, I would be a billionaire. Like, I mean, all my guys, after they hit 50 and their prostates get a little bit larger and they're not making as much seminal fluid, all the guys want to shoot across the room. They all do, right? And it's there's some medications that can maybe inch them in a certain direction, like we try, but
Hmm.
the decrease in volume, we see that when you look at semen analyses over time, and because one of the other characteristics that we look at is the volume of the sperm, right? Because that also
Yeah.
tells us a little about fertility. And so we do see the volume of the sperm decrease over time. And I wish there was something we can do about that. In terms of making your sperm counts better, nature has its way, right? I mean, if you're going to be a healthy person, um, and you don't, I mean, to be honest, you don't have to do much, but nature has its way of kind of making, for the people that are already fertile. I'm talking about, this is a certain population. You're talking about a fertile population, right? When
Yeah.
I say they don't have to do much, right? For the infertile population or the subfertile population, we have to do a lot for those patients. So I'm not making light of that. But for
Yeah.
the person that's fertile, it's really trying to avoid all the things that can cause things to go bad, right? And so, or your counts to get lower, or the motility to get lower. Like, there's some data on cigarette smoking, and obviously there's a lot of people that smoke that can have children. But when you look at, when we're looking at sort of this population of subfertile men, sometimes you just need a little bit to kind of push you in the wrong direction, right? We
Yeah.
find that, at least we're finding, since, down here in Pennsylvania and New York, with marijuana, because obviously marijuana in certain ounces, and I don't know all the laws, but I guess it's legal. We're seeing sperm counts go down. So when a young guy comes in, the first thing I ask, if are you smoking marijuana? That's part of the intake. And oftentimes when they stop, their sperm counts will go up, right?
Interesting.
Sometimes it's easier said than done. I have a lot of guys that are probably dealing with a lot of stress and depression, and they're using kind of marijuana as their medication for that. So it's hard to get these guys that are coming in for fertility to come off all of their marijuana. But sometimes when we lower it, then their sperm counts will go up. So I've been seeing that a lot. Over the
Interesting.
last maybe 5 or 6 years, because I think that, at least in my practice, there's been an increase of marijuana use. So what I'm saying is the things to make your sperm better, the things that we have to do is we have to do the things that we have to not do the things that make our sperm counts worse, right?
Yeah, it seems like it's
That,
more of an avoidance game more than anything.
that's what it is, I think, because I mean, you gotta think that we've been around for, I don't know, humans have been around 100,000 years or something like that. I don't know the exact number.
Yeah,
So
everybody speculates.
right. And so I figured that, through the process, the body's figured out a way, right?
Yeah,
So, when we're in 2024, there's all these things that we can do to bring those sperm counts down, right? All the things that we can do. Like we talked about some of the medications, we talked about drugs, we talked about testosterone, all these things that we can do to kind of put you at in a lesser place when it comes to fertility. But those
yeah,
are, as I mentioned, those are guys that are already fertile. We can make them subfertile. But when we're talking about like the infertile male, when we're talking about a guy that has no sperm count, then we're talking about a totally different animal.
yeah.
Most of those guys, when you talk to them, they've never done any of those things. They don't do things to that would bring their sperm counts down. It's a genetic thing, or it's an environmental thing that they came across that they didn't know they came across. It was an infection. It was an issue with maybe when they were a child and their sperm, their testicles didn't make it to their scrotum, right? So there are some guys that are born that we actually have to surgically bring their testicles to their scrotum.
Oh,
And so it's called an undescended testes. So those guys may have some fertility issues. So there's a lot of things that that happen to us that can cause some fertility issues, and it's not always something that we're doing to ourselves.
that's interesting. I mean, like you said, though, that's a smaller subset of the population. I think for a lot of the guys and a lot of guys that, well, I mean, I don't really know, but for a lot of the dudes that do listen to the show, a lot of them have the ability to influence their sperm positively by making the right choices, I think. And I do feel like you had mentioned weed, and I've heard a lot of people, like a lot of pothead friends of mine, right? They're like, "Well, I smoke weed every day, and I do whatever." And
Yeah,
I'm just like, "Well, that's cool," but to say that it doesn't affect you at all, maybe
I
I
would
think
I
there's
would
more
probably
to it.
say, when guys will say that to me, and they'll be like, "Doc, my count's okay." Well, I would probably say, I would probably counter and say your count would probably be better if you didn't smoke, right?
Yeah,
And and for the guys that and there's plenty of, there's plenty of men that smoke that have children, and they smoke while they had children, and all these, they're smoking while they're having
yeah,
sex, all this other stuff, right? Um, but I would say that their sperm is probably somewhat more compromised than someone that didn't smoke, right? And it's
yeah,
really that fragile. And when we're talking about fertility, it's that fragile it's that fragile individual, right? It's that person that is already probably at the borderline, and these
mhm,
things are just making them lower. If your count is so, if your count is 200 million and you go to 100 million, it's not going to make a difference, but you still dropped 100 million, right? But
yeah.
if your count is, let's say, 20 million and it goes to 3 million, and then that's a big difference, a big difference.
Big
And that's
jump.
going to cause some fertility, right? But that
Yeah,
200 million to 100 million, you didn't really see the difference because they still can have a child. And the delta is different. So that from 20 million to 3 million, it's less, but that's going to make a bigger difference when it comes to your fertility, right? So
that,
it,
mhm,
it's one of those things. It's really that fragile individual that's probably somewhere on the borderline where these things are really affecting them.
100%. And to your point, it's one of those things where sometimes when you improve something, you may not see it on the outside, or you may not feel it the way that you would like to. So it may appear as though it's not the biggest change in the world. However, in retrospect, you're like, oh, wow, as time, that's the thing about time too. It's like you start to see people either, I would say, really take full advantage of the good choices they made when they were younger, and all of a sudden those bad choices start to rear their ugly heads up the older you get. And it's almost like, wait, my body's not fighting it off the way that it used to, right?
Yeah.
So I think it's one of those things where we got to control and do the best that we can with the control that we do have over our bodies. And if we can positively influence it, why not? But another
I
thing that
totally
I
agree.
was
I
thinking
love the
about,
analogy. I love that. It's like getting your roof done at your house.
yeah, you
Like
gotta,
nobody, it's like you put all that money in your roof and you're like, oh my gosh, like it's just a roof, right?
yeah,
Who cares about this roof? But if you don't put that money in the roof, then everything else just falls apart. You're gonna get holes. You're gonna get water in. The wind's gonna
yeah,
blow, and it's gonna be a problem. But you got to put your roof on, right? You
yeah.
gotta spend the money to put the roof on top of your house.
No, that's my philosophy, and that's kind of why I'm proactive, and I try to, learn as much as I can from the conversations that I have with you and all the other dudes that come on the show, because it's like I I don't want to I don't want to live sickly when I'm 60, and I see that a lot. It's a trend that I see where I'm like, oh God, like that's not for me. But another thing that I wanted to ask you before we kind of finish up today, and this is just your thoughts, but you had mentioned smoking weed, which automatically led me to like vaping, right? Because I know cigarettes, I know they're definitely not good, but I just want to know what your take is on vaping, because I see a lot of the young kids are doing it, and obviously I'm not going to tell anybody what to do with their body. However, from your perspective and your standpoint, what's your take on vaping and how it affects the body and how it affects, I guess, sperm health and fertility and all that good stuff?
Yeah, so we don't have a lot of data on vaping yet, right? But I mean, I'm a common sense guy as well, right? It's just,
Yeah.
it's just for me, it just I tell my guys that, at least you see what I tell them. I tell them like, listen, my job is to get you guys to have a child, right? So we
Mhm.
got to be in this together, right? And there's data when it comes to marijuana, there's data when it comes to cigarettes, there's data when it comes to alcohol, all this other stuff. So at least for the time that you're in my office, let's try to cut everything. Let's be on the same page, because I'm going 100%. I need you to go 100%. Right? That's the
Yeah.
conversation I have. And guys are like, Doc, I got to give up my weed. I got to stop drinking alcohol and all this stuff. I was like, you can drink a little alcohol, but not, you got to make, because there's data in terms of how much you can drink and all these other things. But I'm like, all right, get on the same page. Let's try to have this baby. And then after we're finished, you can go back to smoking, vaping, doing everything that you want to do. But my goal is for you guys, and I'm in, my goal is
Mhm.
for you guys to have this baby. So when it comes to vaping, I tell my guys, like, listen, we don't know the effects, right? Are you going to wait
Yeah.
for this? So you want to have this baby now, and your partner is next to you and she's looking at you, right? And she's like, you better be doing everything you can, because I'm getting prodded. I'm getting poked, right? So you better be doing everything that you need to do. So I'm like, are we going to wait for this paper to come out in 10 years? Or were we going to just say, all right, we know that there's a lot of things that we put in our body that can cause some issues with fertility. We know that, there's some data on cigarettes, there's some data on marijuana, some data on all these other things. So we can either wait for 10 years and you can continue to do what you're going to do, or we should just stop right now. And you don't have to be a case study, because we want to be able to have this child. And that's the
100%.
that's the attitude that I take when it comes to certain things like vaping and things that we don't have so much data on. We just got to use our common sense.
Yeah. Yeah, and to your point, it's like if you know something isn't really 100% healthy and you're putting it into yourself constantly, be it alcohol, be it weed, cigarettes, all that kind of good stuff, or even, I mean, if you're taking nonstop pharmaceutical drugs that you may not know what the adverse effects are, I mean, it doesn't really matter what it is. If you're abusing anything, I think it's going to take its toll on the body. So you always want to consult your physician. It's a
Yeah, no, I
perfect
agree.
way to end this podcast, Dr. Gittens. Absolute blast having you on again. If anybody's in the New York or Philly region, I do believe it's a Rockwell Health
Yeah.
Center.
Rockwell Centers for Sexual Medicine. Yep. We're in
100%.
Philly, Philadelphia, New York, and in Allentown, PA.
All right, I'll be over there. We're going to find a plan to make this supplement that's going to shoot out the biggest loads ever and all the guys
Oh man, I'll
that.
tell you, I've been looking for that for a long time. Let me tell you, I've been experimenting. Nothing's working.
Just a celery and water extract or something. I
Oh,
don't
let me
know, man.
tell
I'm
you, I've
throwing it
already
out there.
we tried the celery. Listen, the celery thing. Funny, I had this patient. She's like, Doc, I got my husband. He's shooting all over the place. He's on celery. He's on this. And then I'm like, all right, let's try to do it. And I try it on another patient, and the guy's not doing anything. I'm like, oh, we gotta go back to the drawing board on that one. But
You
celery is
got
one
to
of those
figure out
things.
that
Celery is one
protocol.
of the Yeah, celery juice is one of those things that kind kind of I don't know if it's a old wives' tale or what, but that's one of
Yeah,
that is used a lot. Yeah.
because that's what I heard from like this. I remember this porn star named Peter North where they were talking about him. Like he shoots the biggest loads, and he's like, my secret is I eat 3 chalks of celery before I go to sleep, and drink
Yeah.
tons of water. And I'm like, oh, okay. I'm like, remember hearing that when I was like in high school. I'm like, so that's the secret
That's
then.
the secret. That's the secret. Trust me, I've tried that, but I'm still trying. So if anybody's out there, give me a call. Let me know. We can do a study. We can do
Make
a
it
study.
happen. Reach out to Dr. Gittens in New York. But
That's
thanks
right.
again for coming on the show, and can't wait to have you on again and, pick your brain on other subjects related to men's health, man. But thank you.
Anytime, CJ. It's been great.
And again, all the links are going to be in the description. We'll see you guys in the next episode. There we go.
All right, CJ. That was fun.
Oh, man. Yeah, dude. Always a blast talking to you, but I'm going to figure out that sperm supplement, so.
Oh, hey, hold on. My thing went off. Hold on. Can you hear me?
Yeah, I can hear you good. Yeah, it just
Okay.
told me.
Yeah, we gotta figure that out. We gotta figure that out. I've been thinking about that for a long time. I'll tell you. Somebody out there. So
Yeah, man.
there's some I've seen some things online that they sell it, but a couple of my patients have tried it. A number of my patients have tried a lot of those things. Everybody's like it doesn't make a difference.
Yeah, well, see, that's kind of the big thing. We got to figure that one out, and then we'll market.
Right.
Make a
It's
killing.
right. It's right. It's right. All right, man.
All right, man. I'll hit you up when the episode's good to go, and we'll go from there, man. But thanks again for coming on. I'll see you later, man.
All right. Talk to you soon.
All right, take care.
Bye.
Bye.